Alabama coronavirus hotspot.
Joining us via Zoom this morning is Kathy Woodruff, Chief Nursing Officer at Marshall Medical Centers. Kathy, good morning. Thank you so much for joining us.
Good morning. Thank you for having me.
Now, earlier this week, you said cases in Marshall County are out of control. And when we talked to you yesterday, you mentioned you got caught in the moment when you were just explaining what was going on. And understandably so, your area has been one of the hardest hit here in North Alabama since it began. At this point, you're still trying to get people to take the virus seriously. So kind of walk us through just, I guess, a little bit of what you're seeing out there in Marshall County.
Yes, ma'am. You know, in the very beginning, when we went down this journey, Marshall County has always been considered a hotspot. Our numbers at one point, we were number 4 in the state. As of today, we're number 5 in the state, and that's not a race you want to win. You know, we are number 5, and that's below Birmingham, Mobile, Tuscaloosa, large cities. We are not, Marshall County is, you know, a bunch of small cities. So our population is much smaller than those larger cities. So our numbers shouldn't be as high as they are for the population that we have. This morning we have 1,265 positive cases in Marshall County. And that's, you know, something that's very, very concerning to me. Our inpatient volume, which is the number of patients that have had to be hospitalized because of the coronavirus, has skyrocketed over the last 2 weeks. Before the last 2 weeks, we had 1 to 2 patients, and today we have a total of 23 between the 2 hospitals. So it's very concerning.
Talk to us about that point you just made, Kathy, about hospitals, and at what point would they become overwhelmed with more patients?
We have limited space in our intensive care units, you know, because we are small. You know, both of our facilities are small. So once those beds are full with sick individuals, that would cause concern for us because we don't have, you know, once we reach that capacity, we would have to transfer patients to other facilities if they had beds available. You know, it's hard to say. You know, we prepared for this back in March, and now it's here. So, you know, we're ready, but the Marshall County needs to do their part, the people, to help us get from getting overwhelmed.
It was an interesting fact that David Spillers, CEO of Huntsville Hospital, brought up. He said it takes the equivalent to treat 1 patient with coronavirus is what it would take for 10 patients, treating them in the hospital system. That number to me just seems kind of mind-blowing when you put it in perspective like that. How important is it, just you said, for the community to understand that this is something that you guys are working with just around the clock?
Yes, ma'am. It's very taxing for the staff. You know, they have to dress up in the PPE, which is the personal protective equipment, which consists of gowns and gloves and masks and goggles and hair covers. And when you put all that stuff on and you're in with your patient for hours, it's very, very taxing physically and emotionally as well. And these patients are very sick.
Kathy, we're trying to get the message out there about the seriousness of the pandemic, and it seems like there are some in the public, especially around Memorial Day, that more and more people got out, are not wearing masks. There's even some calls for mandatory wearing of masks and so on. From a medical standpoint, can you give us a message out there and tell everybody just the importance of that, and when should they wear masks and that sort of thing? Because I think that this message tends to fall through for some folks out there about the seriousness of this virus.
Yes, you know, wearing a mask is very controversial. Some people say it's helpful, some people say it's not. From my perspective, it is very helpful. It protects you, and it also protects others that are around you. There are people that are walking around that have no symptoms that have the coronavirus, and they just don't realize it. So, you know, I suggest that you wear a mask and assume that everyone that you come in contact with has the coronavirus. You know, if you're in Walmart, you know, the grocery stores, places where it's hard to maintain social distancing, that's when it's important to wear a mask. When you're outside, when you're in your home, you know, places like that, in your car, you don't need to wear a mask. It's just when you're in public and you can't maintain the 6 feet of social distancing that's necessary.
All right, Kathy Woodruff, Chief Nursing Officer at Marshall Medical Centers, thank you so much for your time this morning. We appreciate you. All right, time now is 6:40 right now on your Friday morning. We do have some